So the anterior cruciate ligament is one of the main stabilizers of the knee joint. When somebody ruptures their ACL, the knee often feels unstable and patients can't return to normal day-to-day activities or sporting activities because the knee keeps giving way. So what we aim to do is reconstruct that ligament and provide the stability back to the knee. So the aim of the procedure really is to allow patients to return to normal activities with a more stable knee. But also the aim is to protect the lining cartilage and the meniscal tissue in the knee, which can be damaged when the knee gives way, and also to help prevent the risk of developing arthritis in the future. So ACL reconstruction is a very safe procedure. The procedure itself involves taking the hamstring tendons from the tibia attachment just below the knee joint, and we use those to make a new anterior cruciate ligament. We drill tunnels through the tibia and the femur, and then we pass the graft through these and hold them very tightly. In order to get the best possible result, it's really important to follow the physiotherapy regime post-operatively. This allows the graft to heal into the tunnel, but also allows a patient to restore movement and regain strength in the muscles while they rehabilitate and get back to their normal activities. So when we perform this surgery, we're obviously reliant on the biology of the tissues in order for the ACL graft to heal into those bone tunnels, which it nearly always does. But there is a small chance that the biology doesn't kick in as we would like it to, and the graft sometimes doesn't heal. There is a small chance that patients return to their normal sporting activities, and because of the nature of these activities, there is a risk of re-rupturing the graft in the future. Having said that, the procedure itself is very safe, and we generally get very good outcomes from it. So most of these procedures are performed as day case operations. So people are in and out in the same day. And we normally allow people to mobilize initially on crutches up to fully weight bearing as comfortable. And we allow people to mobilize through a full range of movements of their knee. People are normally on crutches for between 2 and 4 weeks. And in this time, we start physiotherapy and we start building up activities with some range of movement and strengthening exercises, quadriceps and hamstring exercises, some early cycling and some proprioceptive exercises to regain joint position sense. Having said that, it's normally about 6 weeks before people can return to light activities at work. It's about 3 months before people can do a little bit of light running on a treadmill or some heavier physical activities. And it's about 6 months before people return to running outside, and usually 9 months before people can return to contact or pivoting sports. So it's really important prior to the operation to try and keep as active as possible within the limits of comfort. We don't want the knee to be stiff or the muscles to be wasted prior to surgery, because the knee and the leg needs to be in the best possible condition, really. So I always think it's important for people to carry on walking, flexing the knee, using the knee, doing more usually low impact activities. So avoiding any twisting activities that could cause more damage to the knee, but trying to keep active. And we often ask our physiotherapy colleagues to provide a prehabilitation program prior to surgery.